Have you ever touched a patient in a way that wasn't really necessary for treatment? So the first question is, can stretching actually make you weaker? Yes, if you do a static stretching before a workout or weightlifting training, it can make you weaker. That's why a lot of coaches, they prefer to do dynamic stretching, which can help you to have a better strength throughout the workout. The second question is, my therapist told me to stop using my foam roller. Is that a thing now? Yes and no. The foam roller is not a treatment, but it's a really good tool to help you to increase the blood circulation or reduce inflammation or swelling in the area. So if the therapist asks you to stop doing it, probably either you are doing it wrongly or the injury or problem that you have is not related to that. So that's why they ask you to stop. But in general, we use foam roller time to time. The next question is poor posture really the cause of pain, or is that just outdated science? Poor posture by itself is not a big issue. The amount that you spend or the time that you spend in that poor posture is the big problem. If you have a rounded back and you're sitting the whole day for 8 hours in that position, then that's a bad thing. But if you are rounded back when you're sitting, but you just sit like 10 minutes a day, then it's not a big problem. So a bad posture can cause a lot of problem. That's why whenever we have a patient, first we are trying to help the patient to reduce the pain. And then when we see there's a really bad posture, we want to fix that to make sure the patient is not going to have any problem for the rest of his or her life. So yes, the poor posture is bad. So the next question is, should I always listen to my body? Yes, you should always listen to your body. But if you are professional athletes, you can skip that because the brain is trying to keep you safe. But if you're professional athletes, you have to train more and more. And sometimes the recovery is not going to be the best, but you still have to push yourself. So if you are professional athletes, you don't need to listen to your body every day. But if you're a normal human being and you train for the healthy lifestyle, yes, you have to listen to your body. So the next question is, do you lose muscle if you stop training for a week? The answer is no. For a week, you're not going to lose any muscle strength or muscle mass. The study shows that if you don't do anything for 2 weeks' time, then you will start losing some muscle mass and muscle strength. So till 2 weeks' time, you're safe, but we suggest that at least do once a week of training if you want to keep your muscle mass. So the next question is, should I train when I'm sore? Yes, but if you have a moderate or really low soreness, if you have DOMS, delayed onset muscle soreness, for a long time, or it's really painful, or it's really a lot, then you shouldn't train. But if it's a moderate, yes, you can train. There is no problem with that. But you got to make sure you're not going really heavy with it. The next question is, why did my therapist tell me to stop all upper body exercises when my shoulder hurts? That is a usual thing that we do because of the few reasons. First of all, we don't know how you do the upper body exercises. Sometimes we understand or we feel that you have really unstable shoulder, which is really dangerous to train if you have unstable shoulder. And the third one is that sometimes we feel you have a lot of muscle imbalance. So we stop you to do any activities because we want to make sure you are safe. We try to keep you safe in the therapy. So we try to stabilize your shoulder. We try to do the activities that can help you to stabilize the shoulder. And then after that, we will slowly ask you to start your workout or your training. So it's really normal and usual that we ask the patient to stop any training for a couple of weeks or months to make sure that they are in a safe side and we can do whatever we want to do with them to make them strong, and then we will ask them to start their training. So yes, that's correct. The next question is, should I use a cold pack or a warm pack? It's a huge debate between the cold and warm pack, but a rule of thumb is that if you have any tightness or muscle problem, the warm pack can help you a lot. But if you have a fresh injury and swelling, then the cold pack can help you a lot. And in my own experience, whenever you have a nerve problem, like a sciatica nerve problem, the cold pack can help you way more than the warm pack. The warm pack, the good thing about it is that the first 30 minutes, 1 hour or 2 hours, you feel really good after using a warm pack, but that might cause you inflammation and swelling. But if you use cold pack, first 30 minutes, 1 hour, you're not gonna feel that much, but that cold can reduce and calm down the nerve system, which can help you to have less pain throughout the day. So it depends on your condition. Please ask your therapist before using any of that. So the next question is, how do I know if my pain is from a nerve or a muscle? That's a really good question. And first of all, you have to ask your therapist, because this is something that it has to be done through a test. But in general, the nerve pains, they're really sharp pain, really fast pain, and they're not really consistent throughout the day. But they're really strong, they stop you immediately. But the muscle pain, they're really light pain and they're constant throughout the day, and you want to do a stretching. With that stretching, you feel better after that. But it's better to ask your therapist to make sure you get the best information. So the next question is, sorry if this sounds weird. Here we go. But have you ever touched a patient in a way that wasn't really necessary for treatment? The answer is no. For past 10 years that I'm doing this therapy, every single time when I want to touch a patient, especially if a female patient or a young girl, I will ask them, or a patient with a hijab, I will ask them beforehand. I will ask them, okay, I'm trying, or I want to touch your knee to see the knee movement. Are you okay with that? Are you comfortable with that? And I learned that throughout university, that whenever you want to touch a patient, you have to ask the permission. Because if the patient doesn't trust you, or if they are not comfortable throughout the therapy, you cannot help them and they're not gonna get better. So the first thing is that you have to create that trust. And that's why we tell all the therapists as well, whenever you want to touch a patient, you have to ask for permission, whatever part of the body is that. Because that's a part of our job. We have to touch sometimes the muscle, the joints, especially the joints, to see the movement, to feel the movement, so we can have a better assessment. So no, without permission, I have never touched a patient, and I won't do that. But I have heard, unfortunately, a few stories that happened to the patients and clients that they were uncomfortable throughout the session. So if you're a therapist, please ask the patient beforehand if you want to touch them. And if you're a patient or client, if you ever experience this throughout the session, please immediately tell the therapist and tell them you're uncomfortable with the situation or process. They know how to handle it, hopefully. And if they don't, just talk with the person in charge and they will move you to another therapist that you will be more comfortable. Because the most important part of the therapy is to creating that trust. So no, I have never touched a person if it's not necessary. And the last question is, how many times should I do my exercises at home? We have a lot of variety of questions today, but it completely depends on your therapist and the plan you have. If the goal is muscle activation, you can do it every single day. We ask the patient for first 2-3 weeks because they need the muscle activation. We ask them to do it every single day. But if the goal is muscle strength, then 3 times a week is going to be enough, because you need some time to rest and recovery. But ask your therapist, they can help you better. Perfect. That's it for today. If you have any question, please write down in the comment or send us a DM on Instagram. We try to answer it in the next episodes. Thank you for watching, and I will see you in the next one.